morning, everyone, and welcome to the first white coat ceremony for the Kane University Physician Assistant Studies program. I'm Dr. Carol Biscardi. I'm the program director and kind of will lead us through this. I would like to welcome our distinguished guests today, Dr. Lamont Repollet, President of Kane University, Dr. Keith Bastian, Interim Dean of the College of Health Professions and Human Services, Mr. Andrew Brannon, Senior Vice President of Finance, I think he's sitting in the audience somewhere, and our program faculty, Professor Robert Adamczyk, Director of Clinical Education, Professor Tiffany Eben, Clinical Assistant Professor, Professor Samad Jaramillo, Clinical Lecturer, and Professor Wendy Rich, Director of Didactic Education. And I'd also like to welcome our keynote speaker this morning, Eileen Munch. I welcome to family and friends who are here and those on live stream who are sharing this important milestone for our inaugural class of 2024. I would like to, at this time, to ask Dr. Repollet to say a few words to our students.
Thank you. Good morning, everyone. Before I begin, I just want to just shout out the PA. I've been watching you on social media. Great job bringing exposure. It seemed like, was it Good Morning America? You guys have been like 2 years in a row? All right, awesome. Well, thank you very much for really just putting a spotlight on our program. Our program is young and it's new. However, but just talking to the staff and talking to some of the students, you guys are in great hands. I want to just say thank you very much for committing to this university. Sometimes we lead by faith, and I think the decisions that you made to come here to Kane, being the first cohort, is special. So you guys will always hold a special place in our heart in the university because we understand that you are trailblazers. So I wanted to personally say that to you. Thank you. It is a pleasure to be here to celebrate this milestone white coat achievement with you. You are Kane's first ever physician assistant students in the university's newly formed College of Health Professions and Human Services. So that was a nice ring because it was, the Nathan Weiss Graduate College, right? No different, right? I actually like this. Thank you, Interim Dean Bastian. You have every reason to be proud of yourselves and to feel good about your future. Earning your white coat is a symbol of readiness. It is a symbol of transition from theory to practice, from the classroom to profession. At Kane, receiving your white coat also represents you're climbing one step higher towards your dream job. Congratulations for making it this far. I also want to thank you again. Thank you for choosing this career path and for pursuing your graduate studies at Kane. As the population ages, there are doctors' offices, hospitals, and outpatient care centers in every state and in every medical setting, and specialties who are seeking world-class candidates with compassion and empathy, strong communication and problem-solving skills, the ability to work well under pressure, and most importantly, a focus on patient care and improving healthcare access, equity, and quality. You are the very best candidates that we have so far, and I assure you, you're more than ready. And you are what Kane has been waiting for, so thank you, and I salute you once again. You're earning your degree from New Jersey's Urban Research University. Last year, Governor Murphy and the legislature designated Kane University as New Jersey's first urban research university. So over the last couple of months, we've been kind of talking about defining what that means. But I'm not going to tell you now because you will experience exactly what it means to be Urban Research University with the work and the practice you're going to be doing in the future, especially coming up shortly. Your physician assistant's graduate program was designed to specifically address healthcare disparities in our communities and to build our university's commitment to equity and academic excellence. That means you're preparing to provide greater access to health care and to improve patient outcomes for a wide range of people, including those who are historically been underserved. So that's when we talk about that urban research piece. But more important, look around and look at the diversity within our team and our students. And so we talk about Kane, the diversity and our strength. Look at this. So I'm going to applaud this faculty and the staff and the program for not just selecting quality candidates, but selecting a diverse quality pool. Because we understand access and affordability is key for all of us, and it starts here at home. So thank you very much, and you guys look amazing. I love the hues and the colors and the gender. So that means, what does that mean? That means that this white coat, you wear this white coat with pride because you've earned it. As you look ahead, take time to honor your victories. Remember to do no harm and never stop learning. And at Kane, we say, cougars climb higher, but we do it together better. Congratulations, and I applaud you once again.
Thank you, Dr. Repillette, for those beautiful words. Dr. Bastian, would you like to say a few words as well to our students?
So first, I would like to welcome everyone here to this very auspicious occasion, the White Coat Ceremony, and to congratulate all of you future physician assistants for all that you've done up to this point to get to your transition to the clinic. I haven't had a lot of time to prepare for this, and I don't have a lot of history and background, so I did some research on the significance of White Coat Ceremony. And one kind of what struck my eye immediately was it says, the dean gives an inspiring speech. That isn't going to happen. We've already had an inspiring speech, so we don't need another one, so I'm off the hook. No, but this is a very significant point. It's a rite of passage. It's a recognition for all the hard work that you've done up to this point. It's a symbol of professionalism. You will take an oath that will commit you for your career to do service and to respect humanity. What else should I say? I don't want to get in the way of picture taking, so I won't go too much longer, but I'm just very proud of this first class of students, of the program, of the college that I'm now responsible for. I think I'll just be an interim dean, but it's really enticing, all the great things that we can do going forward. So I hope to be here again another year from now. Anyways, congratulations and good luck.
Thank you, Dr. Bastian. I think short speeches are always memorable, so you're okay. Professor Eben, can you please come forward to introduce our keynote speaker?
Good morning, everyone. It is just a pleasure to be here with you all and to see everybody's smiling faces. And I'm so excited as a new professor to see all my students enjoying this. It is also my pleasure and my honor to introduce our keynote speaker today. Eileen Munch and I go back probably about 12 years now, having been classmates in PA school together. So I am very honored to be able to introduce you all to her. Eileen has actually been in healthcare since 1984. She started out as a pediatric LPN and then became a certified vascular tech, working with a vascular surgeon for about 12 years. She completed her Bachelor's of Science in Biology and graduated from the University of Medicine and Dentistry of New Jersey's PA program in 2011. That is now Rutgers. She began her career in general surgery and found out that that was not quite the place for her and transitioned over to neurosurgery and found her niche there. She is a dedicated healthcare professional and has managed many aspects of primary care, from the diagnosis, treatment, and coordinating care with many various specialties. She found neurosurgery to be her perfect fit, and she retired earlier this year. She continues to give back to the PA profession through her knowledge and experience. As many of you know, she came and gave some fantastic neurosurgery lectures to us earlier this year. So would you all please give a round of applause for Eileen Munch, our keynote speaker today.
Good morning, and a heartfelt welcome to our distinguished guests, faculty, family members, friends, and our students. Today, we meet here together to recognize and to celebrate the hard work and determination of these 18 students in the Physician Assistants program at Kean University. The rigorous academic journey that began September 1st of last year for these bright and determined students has come to a critical point. These PA students have studied tirelessly and are now ready to take with them all of the subject matter that they have painstakingly read and reread, memorizing anatomy and physiology, studying all of the form and function of the human body systems. These body systems, in the absence of disease or injury, perform in unison like that of a symphony. These students have learned what happens when the perfect balance of a healthy body is altered, when an ailment or a disease process has declared itself. They have come to this point when they are celebrated by all of us here today, celebrating their perseverance and commitment to knowing that there is more. There is more to know, there is more to do, there is more to be. My name is Eileen Mensch. I am a proud and grateful physician assistant. I am a graduate of the UMDNJ Physician Assistant Program, class of 2011. I graduated alongside of one of your faculty members, Tiffany Eben. I will speak for both of us when I say that we are thrilled to be a part of your white coat ceremony, because in the early morning hours of February 27th, 2009, the day of our white coat ceremony, we had 2 feet of snow that covered this beautiful garden state, and our ceremony was canceled. Not postponed, canceled. Because the next day, our clinical rotations would begin, and we would be scattered throughout the state of New Jersey for the remainder of our program. We would be bringing with us all of the knowledge that we had worked so hard to acquire and step into the clinical spaces to apply that knowledge and to build from it. I am certain that our physician assistant students have been looking forward to this day. I will also say that Tiffany and I have been waiting quite a long time for this ceremony, and we really want to share it with you. And we hope that the hors d'oeuvres are good, because we missed out on those too. I'd like to go back a little and tell you about my journey and some of the things that I am grateful for that have led me here to this very moment. My mother was a registered nurse, working nights in labor and delivery. While in the middle of raising 5 kids with my dad, she decided to go back to school part-time to complete her nursing degree and to earn her certificate in education so that she could become a nursing instructor. My mom knew that there was more. We don't realize often that the paths and goals that we set for ourselves are an example and an influence to others. She has been and continues to be an example in my life. She showed me that there is more to know, there is more to do, and there is more to be. I knew that healthcare was my calling, and I stepped into the space, seemingly taking small steps, but enjoying each step that I took. First as an LPN working in pediatrics and home care, and then into the field of diagnostic technology working in vascular surgery. After starting a family of my own and working hard to balance a full and busy life, the voice behind the desire to know more and do more and be more kept getting louder. But do what? Be what? My boss at the time, a vascular surgeon, talked to me about a profession that I knew little about, a physician assistant. After doing some research, I knew in my gut that this was the right path for me. But man, I would need to hit the ground running. First off was getting things set on the home front with my 3 boys in elementary and middle school. I was accepted to this very institution to complete my prerequisites, and I earned my bachelor's degree in biology, graduating magna cum laude. I was the first student to be accepted into the 3+3 joint BA master's degree program between Kane University and UMDNJ. In comparing the small steps I took early in my career, the steps I was now taking were getting bigger. They were sometimes kind of crooked, and they were definitely steeper. And there was more to juggle while I was climbing these steps. Yes, there was more. The more that I had been searching for was right here in front of me, and I stepped into my place with my fellow PA school classmates, and I was scared. My insecurity took on a voice of its own. I don't belong here. Who do I think I am? Do I really think that I can pull this off? Oh my gosh, is this the more that I was seeking? Because this is daunting. I'm the oldest one in my class. Actually, I was the third oldest. In the beginning, the inner voice of self-doubt was loud. Some days it was really loud. But I kept showing up every day. I dove in, head first, every day. With each new subject that I was introduced to, with each layer of learning that began to stack up, one on top of the other, with each exam that I passed, that voice of self-doubt got quieter and softer, and in time became a voice of self-care and encouragement. As my self-doubt was dethroned, my deep curiosity was once again on top. My desire to know more, to do more, and to be more returned. These inner struggles that we all go through are so burdensome at the time, but when we don't give up and we don't surrender to them, we are fueled by them, and we come through empowered. On March 2nd, 2009, a synergy occurred for me, as it will for you this coming Monday when you begin your clinical rotations. With the weight of months and months of classroom time bobbling in my head, held up by feet wearing sensible shoes, I showed up at 5:30 a.m. sharp at University Hospital to start my first clinical rotation. To actually be a part of a team was so exciting. Meeting my first patient, astutely listening as they spoke their truth and voiced their concerns as they described their symptoms. Then, allowing me to put my hands on them, to examine them, noting the pertinent clinical findings. That first patient encounter, and every encounter since then, continues to be both an honor and a privilege. Working as a student alongside of the medical team as we compiled the list of the differential diagnoses, then coming up with a working diagnosis and a treatment plan brought all that learning into action. Learning on my feet, putting it together, light bulb moments connecting the dots all day long. My interest in surgery was captured early on in my training. I was in awe. This was my fit. This was where I wanted to roll up my sleeves and dig deeper. I wanted to know more. I wanted to do more, and I wanted to be more. PA school was tough, to the very end, but it was worth everything and more. Upon graduating, I started in general surgery, and after getting my feet good and wet, I reached far and worked harder than I ever thought I could as a neurosurgery PA. Talk about learning on my feet. The responsibilities were so much greater, assisting in brain and spine surgery, being on call, assessing critically ill patients in the emergency room moments after their injury or a hemorrhage from a brain aneurysm rupture. The stakes were now so much higher. I had so much more to learn and so much more to do. Seeing new things every day and then reading about them nightly, learning by doing, not always getting it right the first time, and sometimes missing a piece in a very complex puzzle. But there was always someone to ask and someone to guide. I stayed humble enough to acknowledge that I did not know what I did not know, and to be clear about things that I had not yet done before. And I loved it. My dream job. I had arrived. For 6 months, I showed up and I dove in every day. And then, like something out of left field, I felt a lump under my jaw, and it was cancer. The voice in my head was back. Now? But I had worked so hard. I'm an object in motion. I have hit my stride. Now? Yes, now. Now I am the patient. Once again, fear and self-doubt were at my side. as they were back when I started PA school. I was scared, and I prayed. I prayed for the intelligence and the decision-making of my radiation oncologists. I prayed for the skilled hands of my surgeons, and then I put myself 100% in their care because I needed them more than anything. It was game on, not game over. And once again, I showed up. Every day, I dove in, head first, every day. 3 surgeries and multiple weeks of radiation. Help and love was there from so many. Healthcare professionals of all levels extended their hand, and I held on tight. I took the time I needed to allow myself to heal, and then returned to work with a much broader view, a much wider lens, because I had been a patient. I had been on the receiving end. I returned to the role of the healthcare provider with an attitude of gratitude. With each patient encounter, I came away with experiential learning that I could never have foreseen. My thoughts and my movements and my words seemed to mean more. Over time, working shoulder to shoulder, came the bond of trust that grew between my attending physicians, my patients, and myself. The mutual respect and the high level of trust that will grow between you as a physician assistant and your attending physician is something that is so powerful. With your professionalism and commitment, you will earn that trust. You will earn by doing the next right thing to the best of your ability every time. You will feel it, and it will be mutual. A few years ago, my boss gave me this mug. It says, "Keep calm and call the PA." It is more valuable than any trophy I could ever have won. Always, you will strive to know more, to do more, and to be more. You're doing it now, and you won't stop doing it. Digging deeper because you know there is more. Last week, I had the good fortune of being in my dentist's office. How can being in a dentist's office be good fortune, right? But sitting in the waiting room with a slightly older man, we began to chat, and I quickly found out that we were both PAs. His name was Frank, and he shared his story with me, and I was amazed at how different our paths had been. Frank had been a paramedic in the early 1970s, and he entered the Physician Assistant Studies program at Stony Brook University in 1975. Just 10 years after the very first class of 4 students at Duke University pioneered our profession under the direction of Dr. Eugene Stead. At Stony Brook, the majority of his classmates were medics, Vietnam War veterans who had just returned home from combat. Their curriculum was just as rigorous as yours is. However, it was during a time when the challenges of getting this new profession recognized was great. There was significant pushback politically. Frank recalled a heated exchange in which a New York politician stated that he would personally see to it that the PA profession was aborted. The roadblocks they faced were frequent. Financially, insurance companies refused to pay for reimbursement services. These were such different times. Frank and his fellow PAs worked diligently to form physician assistant societies, state by state, to move through this bureaucracy. Together, these state PA societies tirelessly persevered as one united voice and ultimately changed the landscape of medical care with mid-level practitioners now in the center of the herd. The passion and commitment of the volunteer efforts of these men and women paved the way for our profession to expand in every aspect of healthcare today. Their options were few. Ours are many. We owe them a great deal as we stand here today with career possibilities, financial security, and colleague respect. They knew that there was more. They fought for themselves and they fought for us, allowing us the opportunity to know more, to do more, and to be more. A good teacher will hold and direct a light so that the student can do the digging. As you now leave the classroom, you will take with you all of this newly acquired knowledge, and you will go deeper. Your teachers will be all around you, and you will continue learning. Your surgical and medical attendings, your junior and senior residents, your tenured PAs, your nurses and therapists, as well as your fellow PA students, and most of all, your patients. They are all your teachers. Take the time to listen intently and think deeply, and take the time to care, because there is so much more. The white coat that you will receive today is a symbol. It is not a gift. This white coat represents your professionalism, your intelligence, your dedication, and your determination to know more, to do more, and to be more. This white coat says that you have earned the right to step into the space, to have the opportunity to serve. Be safe, and may God bless you on your journey. Thank you.
Thank you, Eileen. That was inspiring, even for me as a PA for 40 years. That's a very, very nice story. Thank you. Today we have a very special presentation to make today. Professor Adamczyk, can you please come forward?
As some of you may know, earlier this year, we lost one of our PA students, Hannah Syed. From the moment we first met her on her Zoom interview, we knew that there was something special about her, and those thoughts were confirmed when we met her in person. She had a strong desire to become a PA and knew that just getting into a PA program would be difficult. But she accepted every challenge and worked hard to turn this desire into a reality. She wanted to become a PA not just to help those with health issues, but to work with them, to understand their illness and treatment, and to work towards overall better health. Hannah understood the importance of listening to people, to be sensitive to their fears and concerns and values. That you sometimes learn a lot more about a person's health just by listening to them. To have empathy for people, no matter who they are. The importance of teaching and empowering people to become advocates for their own health. All of these are qualities of a great PA, and I know that Hannah would have become a great PA. We can remember her as an example of what we all should strive for. She will be forever in our hearts. Hannah's family is here to accept her white coat from the program in her memory.
Okay, now we will coat each student by advisor group. So with the advisees of Professor Adamczyk, please come forward, stand at the bottom of the step, and each student will come forward one by one. Thank you. Okay, Natalie Carr, go up the step. Yeah, go up the steps. I'm sorry we didn't have a PowerPoint for you guys. I know that's how you learn, but. Jasmine Darko. Karen Fields. Stephen Hush. Sunena Kanchan. And Jocelyn Macias. Will the advisees of Professor Eben please come forward? Mohammed Abolenin. Alexis Brewer. Sabrina Lego. Victoria Maslov. Rachel Mills. Brielle Washington. All right. Will the advisees of Professor Jaramillo please come forward? Zoe Ammon. Kristen Barrera. Rizwanur Khalil. Caroline Newey. Oh, did I skip over Ashley? Ashley Brower. And Alyssa Ramirez. And now, students, I ask you to stand and in front of President Repollet, your faculty, our dean, and your family to cite the physician assistant oath. Go. Congratulations, students. Before you sit down, please acknowledge the faculty who have worked tirelessly for the past year, the 12 months of I don't even know what to say it was, but we got through and we got you through, so please acknowledge all the hard work. And please turn around and acknowledge those who have supported you through all of this. That's it. I get to say the last word, as usual, for this class. No offense, President Repollet. But I said my piece yesterday to you, and the learning now will not be through PowerPoint. It will be your striving to get more knowledge, to learn from each patient. And as I said yesterday, you may not know everything to take care of your patient, but a smile, holding a hand, doesn't take too much knowledge, and you could do that. And respect everyone that you meet, and remember, they have a story, they have something that they need you to hear, and please listen. Okay. Congratulations. Very proud of you all. And thank you. We will be doing group pictures at the end here. So family, you can stay and take your pictures. The photographer wants to put up some lights. We have some refreshments coming as well. So thank you all for coming and sharing in this wonderful milestone for our students in our program. Thank you.